You wake up, and before your eyes even fully open, you feel it. That sticky cotton ball feeling on your tongue. Your lips pull tight when you try to speak. Maybe your throat feels like sandpaper, and the first thing you do, every single morning, is reach for a glass of water just to feel normal again. You might have blamed it on the weather, or the fan running all night, or just getting older. But here's what almost nobody tells you. A dry mouth every morning isn't random. It's your body sending you a message, and depending on which message it is, the fix could be as simple as changing one habit before bed, or it could be something worth mentioning to your doctor at your next visit. Today, we're going to walk through 10 real reasons your mouth may be waking up dry after 60, starting with the ones that surprise people the most and building toward the one that's most often overlooked. Some of these you'll recognize instantly. Some might genuinely surprise you. So stay with me, because reason number 4 is one that almost nobody connects to their morning dryness until they hear it explained simply, the way we're about to do right now. Let's begin. Number 10. Your salivary glands are actually slowing down. Let's start with the most basic explanation, because it's real and it's more common than most people realize. Inside your mouth, you have several small glands whose entire job is to produce saliva. Think of them like little factories that never stop working, day and night, quietly keeping your mouth moist, protecting your teeth, and helping you taste and swallow food comfortably. As we move through our 60s, 70s, and beyond, research suggests these glands can gradually produce less saliva than they did decades earlier. It's not dramatic. It's not sudden. It's a slow decline. Similar to how our skin naturally makes less collagen, or our joints naturally produce less cushioning fluid over time. Let me tell you about a woman named Carol, 68 years old, who came to see a doctor friend of mine after months of waking up with what she called a desert in my mouth. She wasn't on many medications. She drank enough water during the day. But every single morning, the dryness was there. After some simple questions, the doctor explained something that genuinely relieved her. This can simply be a normal part of how salivary glands age. Not a disease, not something broken, just slower. Carol wasn't thrilled to hear it's part of aging, nobody ever is, but she was relieved it wasn't something more serious. And once she understood why it was happening, she could finally do something about it, instead of just feeling confused every morning. Here's the reassuring part. Even when saliva production naturally slows down, there's usually still a lot you can do to support it. Staying consistently hydrated throughout the day, not just gulping water once in the morning, can help. Some people also find that keeping a small glass of water by the bed, taking a sip if they wake up during the night, makes mornings noticeably easier. This one, on its own, is rarely something to worry about, but it's often just the first layer. Because for many people, there's something else stacked on top of natural aging, something most of us take every single day without a second thought. And that brings us to the next reason, one that quietly affects millions of people over 60 without them ever realizing the connection. Number 9, your medication cabinet might be the culprit. If you take a daily pill for blood pressure, allergies, depression, anxiety, bladder control, or even a common antihistamine before bed, this next part is for you. One of the most common and most overlooked causes of morning dry mouth is something already sitting in your medicine cabinet. Here's the simple science. Many common medications, including certain blood pressure drugs, antidepressants, antihistamines, and decongestants, can reduce how much saliva your glands produce as a side effect. It's not that the medication is bad, it's simply how the chemistry works for some people. The medication is doing its intended job in your body, and dry mouth can quietly ride along as a side effect. I want you to picture a man named Robert, 72, who started a new blood pressure medication his doctor prescribed for a very good reason, to protect his heart. Within a couple of weeks, he noticed his mouth felt drier than usual, especially at night. He almost didn't mention it because he figured it was unrelated. But when he brought it up at a follow-up visit, his doctor recognized it immediately as a known and fairly common side effect of that class of medication. The reassuring part of Robert's story is this. He didn't need to stop his medication. His doctor simply adjusted the timing of when he took it and recommended a few mouth moisturizing strategies for nighttime. Within a couple of weeks, his mornings felt completely different. This is such an important point to sit with. If you take multiple medications, which becomes more common as we get older, the combined effect on saliva can be greater than any single medication alone. It's not about panicking or stopping your prescriptions on your own. It's about being aware and mentioning it to your doctor or pharmacist so they can review your full list together. A simple next step. Next time you're at the pharmacy or your doctor's office, ask, "Could any of my medications be contributing to dry mouth?" That one question can open the door to solutions you may not have known existed. Now, medications are one thing you're actively putting into your body. But there's something else, something happening while you sleep, that you have almost no awareness of, that might be drying out your mouth every single night, without you even knowing it's happening. Number 8. You might be breathing through your mouth all night. Here's a question. Have you ever woken up and your pillow felt slightly damp near your mouth? Or maybe your partner has mentioned that you sleep with your mouth open. If so, this next reason might be the missing piece. When we sleep with our mouths even slightly open for hours at a time, air continuously passes over the tongue and inner cheeks, evaporating moisture much faster than normal. It's a bit like leaving a glass of water uncovered near an open window overnight. By morning, there's simply less there than when you started. This tends to become more common after 60 for a few connected reasons. Nasal congestion becomes more frequent. Sleeping positions can shift as we age. And conditions like sleep apnea, where breathing is briefly interrupted throughout the night, become more prevalent in this stage of life. Let me share the story of a man named David, 65, who couldn't understand why his dry mouth was so much worse than his wife's, even though they lived the same lifestyle, ate the same meals, and drank similar amounts of water. It wasn't until his wife mentioned that he snored loudly and seemed to gasp occasionally in his sleep that they considered something beyond simple aging. A sleep evaluation suggested signs consistent with mild sleep apnea, a condition where the airway partially narrows during sleep, often causing a person to breathe through an open mouth to compensate. Once David worked with his doctor on some evidence-based strategies for improving his airway during sleep, his morning dryness improved significantly, almost as a welcome side effect of addressing the bigger issue. Now, I want to be clear, not everyone with morning dry mouth has sleep apnea. Most of the time, mouth breathing is simply linked to mild congestion, allergies, or the natural way someone's head rests on the pillow. But if your dry mouth is paired with loud snoring, morning headaches, or daytime tiredness even after a full night's sleep, it may be worth a conversation with your doctor about your breathing at night. A simple, low-cost first step many people try. Sleeping on your side rather than your back can sometimes reduce mouth breathing naturally, since it changes how your jaw and tongue rest during sleep. This next reason is one almost everyone experiences at some point, but very few people realize just how much it compounds every other cause we've already talked about. Number 7. Your body may be quietly dehydrated, even if you don't feel thirsty. Here's something that genuinely surprises most people. As we get older, our sense of thirst can become less reliable. That's right. The internal signal that once reliably told you, "Drink water now," in your 30s and 40s, can become quieter with age. This means it's entirely possible to be mildly dehydrated without ever feeling the classic sensation of thirst. Think about it this way. Thirst is like a smoke detector. In your younger years, it might go off the moment there's the faintest hint of smoke. But as we age, that smoke detector can become a little less sensitive, still working, but requiring more smoke before it sounds the alarm. By the time you feel thirsty, your body may have already been running low for a while. Let me tell you about Margaret, a lively 70-year-old grandmother who insisted she drank plenty of water. But when she actually tracked it for a week, she realized most of her fluid intake came from her morning coffee and evening tea, both of which can have a mild dehydrating effect due to caffeine. By the time she went to bed, her body had been running on a fluid deficit all day, and her mouth paid the price by morning. Once Margaret started keeping a water bottle within eyesight throughout the day, not waiting until she felt thirsty, but sipping on a schedule, she noticed her mornings gradually improved within about a week or two. Here's a reassuring practical tip. A good general guide for many older adults is to aim for pale yellow urine as a sign of adequate hydration, though your doctor can give you a specific target based on your individual health, kidney function, and any medications you're taking, since fluid needs really do vary person to person. Small habit, potentially big difference. Try placing a full glass of water on your nightstand and on your bathroom counter. Visual reminders often work better than willpower alone, especially when thirst itself isn't a reliable cue anymore. But dehydration isn't just about how much water you drink. Sometimes it's about something you're drinking or eating that's working against you, especially in the hours right before bed. And that brings us to a reason that catches so many people off guard. Number 6. Your evening habits might be setting you up for a dry morning. This next one isn't about anything medical at all. It's about a few small evening habits that quietly add up. Alcohol, even in modest amounts like a glass of wine with dinner, has a mild dehydrating effect on the body. Caffeine, found not just in coffee but in tea, chocolate, and some soft drinks, works similarly. And salty foods eaten in the evening can pull water out of your tissues and into your bloodstream, leaving less available moisture for things like your mouth and throat by morning. None of these things are bad in moderation. This isn't about guilt or giving up things you enjoy. It's simply about understanding cause and effect. Take the story of Frank, 69, who loved his nightly ritual, a small glass of red wine and a handful of salted crackers while watching the evening news. He didn't drink excessively, and by most standards, his lifestyle was healthy. But when he mentioned his stubborn morning dry mouth to his doctor, and they walked through his evening routine together, the pattern became clear. Frank didn't have to give up his evening wine entirely. Instead, he shifted it earlier in the evening, alternated it with a glass of water, and swapped the salted crackers for a lower sodium snack. Within about 2 weeks, he noticed a real difference in how his mouth felt when he woke up. This is one of the most encouraging reasons on our list today, because it's entirely within your control, starting tonight if you want it to be. You don't need a prescription. You don't need a doctor's referral. You simply need awareness of what your evening habits are doing behind the scenes while you sleep. A gentle suggestion: try having your last caffeinated drink at least 6 hours before bed. And if you enjoy alcohol, consider having a glass of water alongside it. Small adjustments, tracked over a week or two, can reveal a lot about your own personal pattern. Now, here's where we get to something most people never expect to hear connected to dry mouth at all, and it's the one I mentioned at the very beginning of this video. Number 5. Your blood sugar might. Now, here's where we get to something most people never expect to hear connected to dry mouth at all, and it's the one I mentioned at the very beginning of this video. Number 5. Your blood sugar might be playing a role. This is the reason I promised you earlier, the one that surprises almost everyone the first time they hear it. Persistent dry mouth, especially when it's paired with increased thirst, frequent urination, or unexplained fatigue, can sometimes be associated with elevated blood sugar levels. This connection exists because when blood sugar runs higher than it should, the body tries to flush out the extra sugar through urine, which can lead to increased fluid loss, and dry mouth is often one of the earliest, most noticeable signs. I want to be very careful here because I don't want this to cause alarm. Dry mouth alone, especially with a clear cause like medication or mouth breathing, is usually not a sign of anything serious. But when dry mouth shows up alongside other symptoms, unusual thirst that water doesn't seem to satisfy, needing to urinate more frequently than usual, or feeling unusually tired, it can be worth mentioning to your doctor, simply so they can check your blood sugar as part of a routine visit. Consider the story of Linda, 63, who assumed her dry mouth was just from her allergy medication. But she also noticed she was drinking more water than ever, yet somehow felt thirstier than before, and she was more tired than usual even after a full night's sleep. When she finally mentioned all of this together during a routine checkup, her doctor ran a simple blood test that revealed her blood sugar was higher than ideal. The good news in Linda's story is this. Because she mentioned it early, she and her doctor were able to make some manageable lifestyle adjustments together, and she felt noticeably better within a few months. Early awareness gave her options, and that's really the heart of why we're covering this today. I want to be clear that having dry mouth does not mean you have a blood sugar problem. Most people with dry mouth have one of the more common causes we've already discussed. But it's worth knowing this connection exists, so that if you do notice a cluster of symptoms together, you know it's worth a conversation with your doctor, rather than something to quietly ignore. Now, let's move to something that affects your mouth in a very different way, not through blood sugar, but through your body's own immune system. Number 4. An overactive immune response could be involved. This next reason is less common than the others we've discussed, but it's important enough that I want you to know it exists, especially if your dry mouth has been persistent, severe, and paired with dry eyes. There's a condition called Sjögren's syndrome, where the immune system, which normally protects the body from illness, mistakenly targets the glands responsible for producing moisture, including the salivary glands and tear glands. It's more commonly diagnosed in women, and it tends to become more recognized in people over 50 or 60, though it can occur at other ages too. I want to gently emphasize, this is one of the less common causes on today's list. Most dry mouth is not related to this condition. But because it's often under-recognized, and because early management can make a meaningful difference in comfort and quality of life, it deserves a mention. Let's talk about Susan, 66, who had dealt with dry mouth for nearly 2 years, along with dry, gritty-feeling eyes that she'd been treating with over-the-counter drops. She assumed both were just getting older problems, unrelated to each other. It wasn't until a routine eye exam that her optometrist gently asked if she also experienced dry mouth, and when she said yes, he suggested she mention both symptoms together to her primary doctor. That single connection, dry eyes plus dry mouth, led to further evaluation and eventually a diagnosis that finally explained years of discomfort Susan had simply been living with silently. Here's the reassuring part of Susan's story. Once she had a name for what she was experiencing, she and her doctor could focus on genuinely helpful management strategies, from specific saliva-supporting products to lifestyle adjustments, instead of guessing in the dark. If your dry mouth comes paired with dry or gritty eyes, joint discomfort, or unusual fatigue, it may be worth mentioning all of these symptoms together at your next appointment, rather than treating each one separately. Doctors often piece together conditions like this from patterns, not single symptoms. So the more complete picture you can share, the better. Now, let's shift from the physical to something a little more surprising, because sometimes the cause of a dry mouth isn't in your body at all. It's in your mind. Number 3. Stress and anxiety can dry out your mouth too. Have you ever noticed that right before a big moment, a doctor's appointment, a difficult phone call, a nerve-wracking family conversation, your mouth suddenly feels dry? That's not a coincidence. It's biology. When we feel stressed or anxious, our body activates what's often called the fight or flight response. As part of this response, blood flow and bodily resources shift towards systems the body considers most urgent for survival, like your heart and muscles, and away from systems it considers less immediately essential, like saliva production. It's an ancient survival mechanism, and it still switches on today, even when the threat is simply a stressful thought running through your mind at 3 in the morning. For many people over 60, life stages bring their own unique stressors, worrying about health, finances, loved ones, or simply the uncertainty that can come with getting older. If that stress shows up especially at night, in the form of racing thoughts or restless sleep, it may be quietly contributing to morning dryness.
This content is for informational purposes only and is not medical advice. Consult a qualified healthcare professional for any health concerns.